Good evening, everybody, and thank you all for joining us. I can see there's a good crowd sitting there already. Appreciate your time in being here, both Andrea and indeed our viewers. And I suppose to kick things off, a Happy New Year to everybody out there. I'm Wendy Conlon. I'm an equine specialist with Teagasc. To initiate this evening, just a couple of housekeeping things. This webinar is indeed being recorded, and the recording will be made available on www.teagasc.ie in the coming days. And viewers here this evening, you're very, very, very welcome, and you are very much encouraged to submit questions throughout the discussion. You can use the Q&A button, which you should find at the bottom of your screen. Be aware that your questions should not be visible to other viewers. If you can see a chat button, please do not use the chat button, use your Q&A button for this. So I am indeed joined this evening by Andrea Ryan, who is a veterinary surgeon and also indeed manager at Kilcash Equine Clinic, which is in Clonmel in County Tipperary. And a big welcome to you to join us on the 11th in the series of Let's Talk Equine Webinars here this evening, Andrea.
Thank you.
So I understand that your main area of interest is stud medicine, and you have a particular interest in reproductive problems, I suppose, of barren mares. Would you like to add a comment or so to that to begin?
Yeah, I do. I mean, I've been doing stud medicine for, I suppose, probably about 25 years now, and it's one of those areas, no matter how long you do it for, you'll always get mares that will throw a curveball at you. So it's actually a really interesting area of veterinary work, and it's really satisfying when things go well and you know you can manage to get a mare that's difficult to get in foal to have a live foal. So it's probably one of the most interesting areas of equine veterinary, I think, anyway. So I'm still very passionate about it anyway at this stage, so hopefully that'll continue.
Great, and I really look forward to hearing the experience and the advice that you have to offer on that basis this evening. Before we get started into that, also just I suppose to give a little bit of context to viewers here this evening, in your practice you are dealing with both thoroughbred and with sport horse enterprises.
That's right. We start scanning mares usually around the last week in January, and we'll still be at it in September. So we have a very, very long season. So we do flat mares, national hunt mares, and quite a large population now of non-thoroughbred mares. And we do both frozen semen and then mares for natural cover and also embryo transfer. So yeah, we stay going. We're actually doing stud work now probably for about 8 months a year now at this stage.
Oh,
it's a long season.
Busy lady, and we're lucky to catch you before that all really kicks off. So I'm going to ask you now, Andrea, if you don't mind, to start to do your screen share, and I'll just do a little bit of talk just while you're doing that to get that set up. So I suppose, you know, I mean, when we look at it in terms of subfertility issues or infertility issues or whatever we want to talk about in that regard, you know, I suppose they can be you know, quite costly, I suppose, and when we think of cost, we think maybe only in a monetary sense, but there's a cost also in terms of the time input by the breeder, by the vet, and the whole you know, management team as well. And you know, whether you kind of at the end of the season have a barren mare and sort of sit back and accept that and say, well, you know, I'm empty, let's go again, or whether you've gone through a season whereby, you know, between the vet, the stud, and all the various interactions, there has been, you know, multiple efforts and attempts to try to resolve problems or get to the bottom of an issue. You know, it can be a frustrating time, and you know, I suppose sometimes even at the end of it, unfortunately, it can be the vet that gets the brunt of the frustration as well. You know, so I suppose, you know, going into this conversation this evening, you know, I suppose as we go along, we maybe bear in mind as well the you know, the inputs that go into it in terms of the time and the cost and that side of it as well, and you know, where we have to end up, I suppose, in some cases coming to a decision of whether the plug needs to be pulled too.
Yeah, that's true. I suppose that we always at least try and remind people that the vet doesn't get the mare in foal. The stallion gets the mare in foal, and the vet really is just trying to help that process. So, you know, obviously it's January now, so the time of year for autumn barren mare examinations has passed. But I do recommend people, if they've had a troublesome mare and it's been difficult to get her in foal, that the autumn time, so September, October, and even into November, can be quite a good time to do a bit of investigation and do some work. But not to worry, I mean, that's past now and we're into January. But once mares are cycling again, those investigations can still be done. So if you know somebody has a mare that's been very difficult, rather than just sort of ploughing along doing the same thing over and over again, there is plenty of opportunity to investigate that mare. And you know, something quite simple like taking a biopsy, uterine biopsy when she's cycling, will give you a lot of information and let you make a decision whether financially it's worth it and whether your chances of success. So you know, that window hasn't passed by any means, and there's still plenty of opportunity to investigate mares. The one time it's not very worthwhile is when they're in anestrus, in that period usually between about sort of late November and February time. You know, you don't really get a lot of information then, so that's probably the one time that it's not that helpful to investigate mares at that time. So shall I proceed then?
Yeah, absolutely. Like, this provides us with an opportune time now to talk about really getting ready for the season and you know where you can be going next.
Exactly.
So yeah, absolutely. I'll hand over to you, because you're going to talk initially in terms of some general guidelines and considerations, and you know, I suppose you know, they're apt not just for the barren mares, but also indeed for maiden and for early foaling mares as well too.
Yeah, exactly. So I think what I was planning to do is just start with a couple of slides with, it's January, so if you have a barren mare or a maiden mare, what you might do with her, and then we can move along through it, and I can stop after every sort of little section, and if anyone has any questions, that might be a time to answer those. So I'll just move along to the first slide. So I'm just going to move this as well. So it's January time. I suppose we're all very excited now to get going again for a new season, and I was out taking swabs today and getting all geared up for the season. So, you know, everyone's enthusiastic in January about trying to get better success with mares. So I think there's not a huge amount you can do in terms of scanning and investigating mares at this time in January, but it's a good time to just check over and make sure their general health is good. I'm not going to spend too long on this because I know people probably know this already, but I think, you know, we see a lot of mares, I suppose, in the practice that tend sometimes to have terrible trouble with their feet and often terrible trouble with their teeth. And obviously feet trouble tends to really shorten the lifespan and the breeding lifespan of a mare, because particularly when they're heavily in foal, if their feet are bad, you know, they tend to have a lot of difficulty, and often they won't have more than a few foals before their feet, you know, sort of pack in and they get laminitis or really bad cracks, and they just can't, you know, withstand the difficulties of foaling and carrying a pregnancy right to that end stage when they're very heavy. So it's really important, you know, to start the season with good feet and to get them done. And, you know, it's an area that's actually tends to be overlooked a lot in mares, and I think it's probably underestimated how important that is. Similarly with teeth, particularly with older horses, you can feed them all you like, but if they have problems with their teeth, they just won't get the value from the food. So this is a good time of year to make sure the teeth are done, feet are done, and that, you know, whatever you're feeding them, that they're getting the value from that, and that they're going to be in good condition to be covered and going forward. Deworming is really important as well. You could talk for 2 hours on deworming without moving on to anything else. All I would say is that the animals that are most susceptible to problems with worms are actually young stock, so foals and yearlings. But it's really important to make sure that mares are adequately dewormed, because they're going to be contaminating the paddocks that will have foals alongside them in a couple of months' time, or next year, or whenever. And, you know, if you start with the older horses and make sure they're regularly dewormed or checked, have fecal egg counts regularly to see whether they need deworming, and you can reduce the level of worm eggs and larvae on the pasture, then it's easier to manage the foals and young stocks. So
and indeed, if people want to get more detail on this particular area, we did actually do a webinar back in November of last year, and people can refer back to that if they want to get a little bit more detail on that particular topic.
Yeah, exactly. And if anybody has any specific questions, I mean, I can give my email address at the end, and there's no problem with emailing me if they have any specific questions. But, you know, coming into the grazing season, coming out of the grazing season in September, October, and then coming into it in sort of February time, they're the important times to consider deworming for your mares. And then obviously vaccination. Loads of people tend to vaccination January. It's a good time to do for influenza. They're done for the year then when they're getting covered or traveling around or going here, there, wherever, they're done. So this is a good time to get your influenza vaccination done. And obviously for pregnant mares then, they would need to be done for herpes virus and potentially rotavirus if you're in farms where there are large numbers of mares and then large numbers of foals. So January is a good time to get all that done. And then I think in January, people need to consider whether they want to leave mares do their own thing or whether they want to try and encourage them to cycle early. That depends a bit on whether mares are, I suppose, thoroughbred or not. I mean, obviously there's a lot more pressure on thoroughbred mares to get them cycling early, particularly with flat mares. Or it can depend a little bit on whether sort of people are busy and, you know, maybe they don't want to be trying to cover mares in April and May and they prefer to get it done and get it out of the way in March. Left to their own devices, mares naturally wouldn't tend to cycle until sort of late March, early April. So usually what I would say to people, if they're not going to put the mares under lights, then there's not really a whole lot of point in looking at them before St. Patrick's Day because they're just going to be annoying themselves. The chances of them being cycling and cycling properly are fairly low. I mean, there's obviously a few mares that people will see in season throughout the winter, but most mares will shut down and go into seasonal anestrus in the winter and then start again. So if you're not putting them under lights, forget about them till St. Patrick's Day. But for those people who do want to get mares breeding early, and there are lots of advantages to it, as I said, getting the work done early, getting in when maybe for thoroughbred mares when stallions aren't so busy, having an early foal if that's what you want. So if you want to try and get mares cycling early and get them covered in February or March, then you need to consider that mares, they are seasonal breeders and they won't naturally be in season at that time of year. So their natural rhythm of reproduction is triggered by the length of light in the day. So they tend to shut down in winter when the daylight decreases, and then through melatonin, as the daylight starts to increase, they then upcycle again and start cycling. So I'll just move this out of the way. So if you want to get them going early, you can put them under artificial lights and that will move the whole process forward. And I think that's quite interesting. I think sometimes people think if you put mares under lights, you'll gain time at either end of the season. So they'll start cycling in February, but they'll still be cycling away in September, October. And they don't actually do that. And you can see from this diagram here, all it does is actually shift the curve forward. So this darker one is a normal curve for a mare. So she's cycling away in the summertime and then back in anestrus in the winter. And when you put her under lights, it just shifts this forward. So just, I suppose, bear that in mind, particularly maybe if people are planning to take a lot of embryos off mares. If you do put them under lights, you will have this extra time at the beginning, but you will lose it at the end of the cycle. Or at the end of the season.
Very pertinent point to make, yeah.
Yeah, so you're not going to get any extra out of them. You're just shifting the whole thing forward if you want to do that. So the other thing that's important to remember is lights alone won't, I mean, they do work and the mares will cycle, but there are other factors that tend to shorten the threshold to which that first ovulation occurs. And so mares don't tend to go from not cycling to cycling over a week or two. They tend to have this transition period, which actually is really annoying for vets because it can go on for ages and ages and ages when they're sort of coming in and out of season and they're not actually ovulating. But this can go on sometimes for several weeks, and they'll have a wave and they'll have a big follicle and you'll think they're going to ovulate that, and then that goes backwards. And it's usually about the fourth follicle that they ovulate. So it can be quite frustrating when you're scanning mares and you think, yeah, she's in season now, and then you come back 4 or 5 days later and that's gone, and then 4 or 5 days later there's another one, and this goes on. So there are a few things that can kind of help shorten that transition period. And the temperature, obviously, so the transition period, even with the lights, tends to be longer in the winter time. Obviously the level of nutrition, so when mares are in better condition, you tend to have, again, a slightly shorter transition period. unfortunately, the converse is true. If they're too fat, that can make it quite long. And also the presence of teaser actually makes a big difference. So for people that have, certainly a number of mares, even though they can be a bit of a nuisance around the place, a teaser will really help particularly with maidens, get them to go through that transition period quite quickly and have that first ovulation quite quickly. So if you can bear having a teaser around the place, that really helps. And so as well as a lighting program, if you don't want to do that, you can also use an Equilume light mask, and that's an option if you want to leave mares out in the field and don't want to have to be bringing them in at night. So we'll just go through those on the next slide. Just put this out of the way. So lighting is great. It really does work, and mares do cycle. I was out taking a few swabs from mares that were under lights today, and about 2 or 3 of them down along the barn from the teaser were all showing away nicely in the middle of January. It's just important to get it correct. So the way it works is that you're trying to trick the mare's brain through her eyes into telling her that it's later in the spring. So what you're trying to do is to recreate the spring lighting conditions. So this little chart just shows you a few different ways that work. So these are 2 ways. This is no lights, obviously, 14 hours of darkness and 9 hours of light. This is somebody sort of having a bit of a go at the lights without being committed to fully doing it. So maybe putting on the lights at 4 o'clock and then going turning them off at 8:30 or 9. So equal light and dark doesn't work, won't make any difference. These are the sort of 2 most common type lighting things, and it depends what else is going on in the barn. So sometimes in barns where you'd also have late pregnant mares, people will want the lights on quite a bit. So this one is probably the most common one if you just have barn mares only, where you have less than 10 hours of continuous darkness and 14.5 hours of light. So that really is turning on the lights at dusk, bringing in the mares before dark, turning on the lights at dusk and turning them off about 11 or 11:30, depending on whether you're in December or January. This is kind of the same, except just leaving them on a little bit later, or if you're starting very early in the yard, putting them on at kind of 6 o'clock in the morning. And then there is a method of, very few people in Ireland ever use this. I think it's much more common on the continent, where you can use a 1 hour flash of light, and that starts 9 hours out of darkness. The only advantage I can see to that one is that you'd save on electricity costs, but it's quite problematic. And as the darkness changes over the weeks, you might have to move the hours. So, it does work, and it works equally well, but people find it a bit awkward to do. So these 2 methods would be the most common one. So the important thing with the lights, if you're going to use them, is they need to have a period of darkness. It needs to be less than 10 hours. So it's like a day in May or something like that, where you have a pretty short night. But there does need to be some night. So if you have a barn and you have some mares foaling and some barn mares, they like to leave the lights on kind of all night so you can see what's going on, it won't work. It actually won't really help your foaling mares either, but it certainly won't work with your barn mares, because they do need a period of darkness. So you're really just trying to recreate the natural lighting conditions of kind of April, May time. If it takes a minimum of 6 weeks to work, it can take a bit longer, sometimes 8 to 9 weeks. So if you want a mare cycling and ready to cover for the thoroughbred mares by the 15th of February, you need to start it in December. The nights need to stay on till 11. And you need to have horses in before dark. So if you leave them out and you go off somewhere and then you think it's 6 o'clock, I'll run out and bring them in, that doesn't work either. Because naturally that doesn't happen, that you have several hours of light and then an hour of darkness and then several hours of light. So you do need to be committed to it if you're going to use it. The Equilume mask do work as well, but they're quite costly. I think they cost, certainly the last time I looked at it, they're about €400 for a mask. I think people have figured that sometimes they can get a second season out of it, but they are quite pricey. And the other thing I think with Ireland and our weather conditions, I think there's no real advantage to leaving mares out at night here. I think they're much more common useful in countries like Australia, where you would want the mares out and it's a pain to have to bring them in to put them on the lights. But I think because the weather's so terrible here, usually people want them in anyway, and the mares are happier in and they're warmer and they get more value from the food when they're not shivering outside.
Just as a matter of interest in your kind of practice interactions, what do you find are the most common mistakes, you know, in the sense of lighting not working?
Yeah, the three things is kind of it being inconsistent, you know, I suppose. So kind of doing it during the week and then kind of not bringing them in on the weekends, or, you know, we're not bringing them in till 7 or 8 o'clock on the weekend. The other thing is quite a lot of people still think if you just leave them on all the time that will work. And not only does that not work, I think that actually inhibits mares a bit, because they really don't know what season it is then. And I suppose the third thing is people sometimes think it's going to work really, really quickly. So they'll get you to scan a mare by the 10th of February and you'll say, is she under lights? They go, yeah. But it would be 2 weeks, you know. So now 2 weeks of light's better than no light. And the later you start them and the closer they are to sort of vernal transition anyway, they will work and it will help. But if you want them to have already had a cycle in January or 2 and be ready to cover early February, you really need to start it in December. So I think sometimes people think it works faster than it does.
And what about scenarios, Andrea, where perhaps there's, you know, the shadows in the stables or the quality of the light? Does that really matter? Does it matter?
It does not really. I mean, so the amount of light that you need, the recommendation is 100 lux, which is the equivalent of sort of 2 normal light bulbs in a normal stable, or one of those fluorescent lights. The sort of guideline I was given, which I thought was quite easy to remember, is if you can read a book anywhere in the stable.
Mine was if you can read a newspaper.
Yeah, if you read a newspaper, then the light is enough. And if you look at the level of light on a really dark winter's day, it's actually quite good. So it doesn't need to be particularly bright. It just needs to be bright enough that you can read some text. And, you know, if there's a little kind of shadowy corner here or there, that's fine, you know, because that's not that different to a cloudy day in Ireland, you know. So they will still work. So usually you don't need anything particular. I mean, you know, usually those kind of fluorescent lights that most people have in barns and stables is enough. It works pretty well. So the lights do work, and as I say, if you've been organised and you start them in December, then you'll be ready to go in February or you know, or sort of mid-February or whatever. But if you haven't done that and you want to try something else to hurry things along, or if maybe the lights you have started a little bit late, or the light therapy just doesn't seem to have really triggered mares, there are a couple of other things you can do to get mares going. So hormone therapies, I've certainly had varying levels of success with them. I think, like everything with the lights as well, to remember is there's other factors other than lights and hormones with mares. Nutrition is a huge thing, you know. So if you have, you know, for people, let's say with boarding farms or whatever, if a mare arrives in and she's really thin, it doesn't matter how many hormones you give her or how much light you give her, until she starts to gain and her nutritional plane is enough that she starts to put weight on, she's probably not going to cycle very well. Similarly with mares that are really, really fat, that tends to slow them down as well. So they tend to cycle best when they're on a rising plane of nutrition and they already have a reasonable body weight. So that they're sort of gaining weight but aren't fat. That's how they tend to work best. Stress, I think, has a huge thing to slow mares down as well, particularly if you have, you know, if you're mixing mares together, or if you've bought mares at the sales, or you're bringing mares out of show jumping and you're putting them in with mares that are already breeding, they can get quite stressed, and horses can get quite stressed within their groups, and that will definitely slow them down. I do a farm that takes a lot of foreign mares in, and often we'd get mares in with foals at foot, and they would be been checked at home and foal heat, and they were cycling, and the next thing they arrive over and they're not cycling. And I think it's just the stress of coming to a new place, and they've got a foal and they've got a lot of things to worry about. So that does make a difference. But the hormones do help. They work best when there's already some activity. So if you pull a mare in out of the field in the first week of February and you haven't used lights and you think, I'm going to put her on some hormones now to get her going, they won't tend to work very well if the ovaries aren't already doing something. So I think if you're considering using any of these products, it's best to get them scanned first before you start, because otherwise you might be wasting your money and just frustrating yourself. And then I suppose the last thing to remember is if you do nothing, they will come into season. So, you know, if you wait long enough, I mean, there's always a very small number of mares who won't cycle at all in the year for whatever reason, but the vast majority of them, if you wait long enough, will start to cycle themselves. So if you're going to try hormone treatment, these are the three. I mean, there's one or two kind of weird and wonderful things, but these are the three that I would find most useful. So progesterone supplementation, everyone's quite kind of familiar with, and that would be the use of Regulate. Prior to, say, about 5 years ago, we used to use PRIDs quite a bit, and they were brilliant actually because they had a decreasing dose, so the dose would stay high for about sort of 7 days and then would naturally drop. And so I thought they worked very well, and the progesterone was sort of being delivered locally, so it sort of mimics the natural thing. But the formulation of those has been changed, and they're not really suitable for mares anymore. The other thing to remember as well for anyone who has cattle as well as horses is to avoid cedars. They're really not well tolerated in mares at all because they have these kind of wings on them and they stick into the mare's vagina, and they can get quite sore with those. So really the only option is Regulate now for progesterone supplementation. And so it works best if you have a mare that's sort of in mid to late transition. So if she has a bunch of 20 millimeter follicles on her ovaries and maybe a little bit of edema, Regulate will work really well in those. And the way I use Regulate is that I put them on the normal 12 ml dose for an average mare for 7 days, and then I wean the dose down by 2 ml every day, so for the next 7 days or so. And so that tries to recreate the normal situation in a mare where you'll have high progesterone and it'll drop slowly and then allows follicles to grow, because progesterone doesn't fall off a cliff naturally. So if you try and give it in a way that's sympathetic to the mare, it tends to work better. The other alternative for mares that are maybe a little bit further backwards than that would be dopamine antagonists and GnRH agonists. So dopamine antagonists work the same way that light does. So increasing daylight drops the levels of dopamine in mares, and that's what triggers cyclical activity. So the two best known dopamine antagonists are Domitil and Motilium. And they work by sort of, as I say, recreating what the lighting levels do. They do take a while to work, so they won't, you know, if you give mare Domitil for 5 days, they're not really going to be in season, and if they are, they probably would have been anyway. The slight problem with them here is the only formulation you can get here for them is an oral one, and there is a question over how bioavailable they are orally. So it's hard to say. I mean, I went through phases of using loads of it, and then I went through phases of not using it, and then I went back through phases of using loads of it. And it's hard to know with mares when you put them on Domitil. If you wait 2 or 3 weeks and you come back and they start to cycle, well, maybe they would have done that anyway. And I remember one time a colleague of mine telling me she was struggling with a mare and couldn't get her in season no matter what she did. So eventually she resorted to the Domitil tablets and left them there in the farm with instructions of how many to give. Came back a week later and scanned it, and the mare was showing great improvement, great follicles up. So she was delighted with herself until she went into the vet room and saw all the boxes of Domitil still on the counter. So, you know, I think they do help, but I think time helps as well. So I've had varying success with those. And then the other one would be GnRH agonists. So there are 3 of these mainly. So without getting too technical, the way reproduction works as the season starts is the daylight affects the pineal gland, which affects the GnRH levels, and the GnRH levels affect the FSH and LH levels, and that gets the cycling going. So the GnRH agonists work at that brain level to get the FSH and LH pulsing and to upregulate the ovaries. So there's 3 different types you can use. Goserelin is one we use. It's a human formulation actually, so we use it under the cascade where nothing else will work. It tends to be my go-to for mares that just will not come into season no matter what you do with them, and sometimes for mares in lactation and estrus. It's a little implant. It's quite expensive, so it wouldn't be a first port call, but it does tend to work quite well in those very, very difficult mares. Otherwise, then we also use Buserelin, which is Receptal. You can use that twice daily, but it is an injection, so mares get a bit fed up with it, and they need to already be in transition for that to work. So, to be honest, I find that progesterone is probably easier to administer, so I tend not to use that all that much. And then Deserelin is one probably people are quite familiar with. That's an ovuplant, and that's actually quite a short-acting one, so it doesn't really work to get mares into transition. But what it is quite useful for is if you have these mares that are in transition for ages and seem to be in season, and these kind of middle of the road follicles, is sometimes to just induce ovulation in those. So we tend to use that a lot in thoroughbred mares in particular, that are early in the season, that you're just a little bit unsure whether they're actually going to ovulate even though they're well in season. And we'd also tend to use it a bit in the frozen semen programs with mares that maybe don't seem to have the normal edema pattern. We don't entirely trust that they're going to ovulate with the Corylon. So those are the drugs that you can use. I suppose the thing to remember, and your vet would probably tell you this anyway, if you're using Zoladex or Receptal to try and encourage mares to get them going, then ideally you shouldn't use Oviplan to try and induce ovulation, because they're two similar type of drug and they can kind of cause a negative feedback effect. So LH would be the one to use if you've been using these to get them going. So that's, I don't know, do you want me to stop now or keep going for this? Next slide.
I suppose, you know, I mean, I would maybe ask, you know, in the sense of kind of what are the most, you know, what are the most common causes that you come across of infertility in mares, or subfertility, shall we say, even in mares? You know, what are the most common reasons that you come up against problems?
Yeah, I suppose it depends on the age of the mare. I mean, by far and away, the most common reason for subfertility in mares would be low-grade endometritis. So mares, every mare that gets covered by a stallion or inseminated will have a reaction to the semen. I mean, semen is a foreign protein, so mares will react to it. That's natural, and they will want to get rid of what they don't need. And that's a normal reaction, and a normal mare will clear that reaction within about 24 hours. But there's a section of mares, it's quite a lot of them actually, it keeps us busy, which have this situation where they have what's called persistent mating-induced endometritis, or PMIE we call it. And those mares are susceptible mare, what we call susceptible. So you've mare, you can fit mares in your head into two categories. They're either resistant to PMIE, so you put the semen in, or the stallion puts the semen in and they clean themselves out and they tidy themselves up and away they go. Or you can have mares that are susceptible to PMIE, and those are the ones that we are troubled most with subfertility. And those mares are just very, very sensitive, so they're the ones we have to do most work on. And somebody a little bit crudely said to me at one time when I was at a course years ago on AI, and they said some mares you could put a bucket of dung into and you come back the next day and they're perfectly clean, and other mares you could put 1 ml of semen into and you come back the next day and there's a bucket of dung inside them. And that really is the difference between those two mares. So the biggest cause of subfertility, I would find, are those mares. And if they're not recognized and treated appropriately, that inflammatory reaction in the uterus tends to cause fibrosis and the laying down of scar tissue. And that laying down of scar tissue and chronic reaction and chronic inflammation in the uterus tends to make the uterus quite wooden and inelastic. And in mares, the placenta and the uterus are continuous. So very different to cattle, where you have your cotyledons and your little spots of placentation. The mare's placenta and the uterus stick together the whole way around, and they are like Velcro almost. So the connections are like this. So the uterus is invaded by the placenta. It burrows in with like little burrs like Velcro and sticks into that uterus. So if the uterus is it gets scarred because of a lot of inflammation and you have a lot of fibrosis, then it's quite tough for the placenta to invade into. So instead of this, you end up with this, you know, which is a pretty weak connection. And those are the mares that tend to abort or tend to suffer from placentitis. So the biggest thing that we have to deal with are these mares that have this chronic inflammatory reaction that's not really treated, and that you then end up with this kind of scarred, fibrosed, troublesome uterus. Now, I suppose, I mean, even healthy mares over the years, you know, they do tend to, their uterus does tend to degenerate. So all old mares tend to be subfertile, to be honest with you. Once they get over 15, they do get a little bit harder to deal with, but some way more so than others. So I think that's probably why, either in the autumn or now in the spring, once you get mares cycling, it's a really good time to try and decide, you and your vet, is your mare a resistant mare or is she susceptible? And if she's susceptible, then what can you do to help damage that's maybe already there? And that's where the biopsy would come in, or certainly prevent further damage. And that's where it's sort of the post-covering treatments and the pre-covering treatments and all that kind of stuff.
So I suppose in one sense, you know, record keeping and kind of a knowledge of the history of what's going on is important to you. And then, you know, moving forward from that, you probably, you know, you have your slide here and you kind of have your checklist of your checks that you go through, and, you know, the examination of the physical, I suppose the physical barriers, and then what's going on inside beyond those barriers. Yeah,
so I keep, so the mares that I do where I would, let's say the thoroughbred mares that I would follow through for the year, I keep a sheet for every individual mare, and there's a lot of mares I would have their sheets going back for the last 10 years, so I could root out what they did 5 years ago. And I keep a record of everything that happens for that year. And so then I know the ones that are troublesome, and, you know, I know what their history is. I know what we've had to do in the past to get them in foal or keep them in foal. But yeah, so good record keeping is hugely important. And for owners as well, I suppose, to be realistic and realize that, you know, mares aren't machines. They're not all super fertile, and that there's a lot of variations as to why some mares are fertile and some aren't. I mean, you know, there's obviously a genetic component to it, because I've certainly seen over the years that some families, you know, the dam isn't great to get in foal, and then the next thing you have her daughter coming along, she's not fantastic either. So there is a genetic component. There is a big shape component as well. I mean, some mares have just a better shape for breeding. This is a lovely picture here. We don't see as many of those as we'd like to see.
Staring at us off the screen. And of course, obviously, you know, body condition will impact this as well too.
Yeah, exactly.
To a degree.
Oh, absolutely. I mean, race mares, you know, they can actually have quite a bit of problems, because, you know, they can be quite thin here and the vulval lips can be pulled apart. And then older mares as well, you get a situation where you have blanknoptosis, which is where just the belly drops a little bit, and the gut contents are just a bit heavy, and everything kind of sags a little bit, and so the mare's anus is pulled forward, and this area here is pulled up over the pelvic brim, and that's kind of an aging changes. But some breeds and some particular type mares, and again some families, will be like that when they're 7 or 8, where others will still look like this when they're 14 or 15. So there is a genetic component to it. There is.
You can do things to manage that as well too.
Oh, you can. I mean, within reason, yeah, absolutely. Yeah. You can do Caslicks, and you can do things to try and. I think that to get the best longevity out of your mare, and I suppose, like everything, and it's probably easy for me to say because I'm a vet, so obviously it's in my interest that people do this. But if your mare's worth breeding from, she's worth looking after properly, and, you know, if you're careful about your treatments around covering and how you manage her around her breeding life, and also her foaling. I mean, a difficult foaling can really, you know, cause a lot of trouble for mares. Damage to the cervix can pretty much end a mare's career if it's very severe, but it can certainly limit it. So all those things really matter. And I suppose if you think, like, you know, mare only has one uterus, one vulva, one vagina, one cervix, and the more you do to kind of mind it and look after it, and bear in mind that we're expecting them to produce a foal every year, you know, or certainly 3 out of 4 years or 4 out of 5 years, you know, it does take a little bit of management to keep everything clean and right as best we can, and try and get the longest time out of mares that you can, you know. So we do expect a lot out of them at times. So, you know, I think if you want that, you sometimes need to put quite a lot in.
You mentioned here in this particular slide the use of biopsies, and there's actually a question in. Well, I'll kind of pose it twofold in terms of what's the kind of information that you can get from a biopsy, but there's also a question here in terms of if a mare has a biopsy done at this time of year, does one need to skip a cycle before covering her?
So I'll go first to just when to take the biopsy. So the biopsy is most revealing when mares are cycling. So there wouldn't be a lot of point in taking a biopsy unless you've had a mare already under lights at this time of year. But if you have, and she's either in late transition, in season or has had an ovulation, then a biopsy is a good time to take one. Probably the best time to take a biopsy, if you had a choice, or if you happen to scan her and know where she is and then plan it, is, I would say, mid to late diestrus. So that's the period in between cycles when they're just thinking about coming into season again, but are not actually in season. And that's from the point of view of the vet and the pathologist, that they can get the best information, because when mares are very in season, particularly early in the year, they sometimes tend to have a really strong edema pattern, and there's just so much edema that the pathologists find the biopsies quite hard to interpret, because everything is just really swollen. So it's hard for them to tell, is everything really swollen because if she's in season, or is everything really swollen because she's quite inflamed? So if you can take a biopsy when mares are not in season and in between cycles, then from the pathologist's point of view, they know what to expect. So if this mare is in diestrus, has a CL, shouldn't have a load of edema, and she has, then that helps the pathologist know that something's wrong. In terms of, can you cover the next cycle? You can. I mean, the injury to the uterus in a biopsy is very small. So within a day or two, that will have healed up. The thing I would say is you probably want the information from the biopsy before you cover her again. So most often, a cycle is missed once you take a biopsy, because it takes about, I suppose, depending on how busy the labs are, it takes about a week or 10 days to get the results. So by the time you have the result back, if you've taken it in that time, then she will have come through that cycle, and you'll need to wait to come around again. If you take one in estrus or late estrus, just as they're about to go out of estrus, sometimes that can work quite well, and then you will have your results back and be ready to go before the next cycle. In terms of what a biopsy can tell you, it can tell you an awful lot, actually. It's a really useful technique. It's not particularly expensive relative to a lot of the work that's done around mares, and it's really revealing. So, I mean, I would suggest to anyone who's had a mare who's failed to go and foal for a full year, you know, if she's been tried 3 or 4 times and there isn't an obvious reason, or she hasn't, you know, gone to a stallion that's obviously having major difficulty, then it's worth doing a biopsy. It's certainly worth doing one if she's had 2 years, because you're working in the dark a little bit otherwise. So the biopsy give you a lot of information. The way they're graded on a scale that predicts the chance of them having a live foal going forwards. Now, it's not a definite thing, but they're usually 2A, 2B, or grade 3, and sometimes that can be split into A and B, and that's just basically a prediction. So mares that are 2A would be considered to have quite a good chance of carrying a foal to term. When it goes to 2B, a little bit less so, and then 3, you're into the sort of difficult mares. That has to be taken in context with what the problem is that shows up on the biopsy, and also what you can do about it. So there's certain situations, if you get a biopsy result and there's really severe fibrosis, then you're limited in what you can do. Whereas if you get a biopsy result and the level of fibrosis isn't too bad, but there's quite a lot of inflammatory debris in the glands and just inflammatory tissue or something like or inflammatory cells, then you can often do something about that, and so you're a bit more optimistic about that mare. It will also be quite useful to detect if you have fungal endometritis or something like that in a mare. And occasionally it can be helpful to detect dormant strep, although they don't always show up in a biopsy. So, I mean, I've never taken a biopsy and thought that there was no point to that. I've always got information, and I've never taken a biopsy and it's come back normal, because the ones with the normal biopsies are usually in foal. So, I mean, generally when we take them, there's always a problem, but you know, I'm always wiser after it, and I always feel I'm able to give people a bit better an idea whether they're likely to succeed or not with their mare.
And just, I suppose, there was a question came in here as well, just in relation to, I suppose, unusual follicle development or slow follicle development, and you're back there, I guess, into your hormone interventions as well.
So I mean, slow, where follicles are a bit slow and kind of sitting there maybe, and you have a whole bunch of 20s, we call them bunches of grapes, and they look like that. You have a whole bunch of 20s or 25s on either side. The hormones tend to work really well on those. Of all the hormones, I think, particularly if there's a small bit of edema, progesterone works the best in those. And really what it does is try and trick the mare that she's had a cycle. In terms of unusual follicles, you maybe the person asking the question might be referring to hemorrhagic follicles or anovulatory follicles and things like that, and they can occur particularly early in the season. So we call those HAFs, or hemorrhagic anovulatory follicles. They tend to occur early in the season. They tend to occur sometimes if you started PGing mares thinking, well, she's not doing anything, so I'm just going to give her PG and see if that gets her going, particularly if you're PGing mares where there's no CL and they haven't had an ovulation, they can occur. You tend to get them a bit more in older mares as well. And you tend to often, once you have one in a mare, they'll tend to sometimes have a couple of them in a row. They're very troublesome. They're a pain, and the only way to deal with them if mares aren't cycling with them is actually to put the mare on Regulate, and again try and trick her that she's normal, and then when you take the Regulate off and give her a prostaglandin, it might just sort of reset the whole thing. So you do tend to get a lot of those in February, and also you tend to get them sometimes in foaling mares that foal early foaling mares. You tend to find those as well.
There's another question here. A mare with PMIE got her in foal this year. Is there anything that can help with it post-foaling or pre-breeding again?
Yes, so if you have her in foal this year and she hasn't foaled already, it's probably worth considering maybe doing a scan to check her placenta, because mares that have had PMIE, even when it's successfully treated, depending on what's going on in the uterus, they can be a little bit susceptible to placentitis. So if you've had a mare that was quite difficult to get in foal, I would recommend maybe, certainly when they get to about 7 or 8 months of pregnancy, to maybe consider getting them scanned to check the placenta, make sure that that's working correctly and well attached and the cervix is closed and everything is going along normally, because there are a few things you can do to intervene if that part of the placenta that touches against the cervix looks like it's under a bit of trouble. But assuming that's all going well and she goes ahead and foal, I think, there's a really good opportunity with mares in foal heat to look at what's going on, have they any infection, and to try and correct it and tidy it up then before you go around to the next cycle. So I mean, certainly mares that are difficult, have had a history of PMIE, or difficult foaling or anything like that, I would never consider covering them on the foal heat, but I would use that heat as an opportunity to see if they're clean, to see if they need any treatments, to repair caslix and all that kind of thing. So that would be the time to do that, and do a cervical swab at that time and all that kind of thing, so that when you do come around to covering them the next time round, they're clean. Because if you start with a mare that's inflamed or has some infection and then you put semen in there, it's just going to trigger it and make it an awful lot worse, and then you're on the back foot trying to calm everything down. Whereas if you get them clean and have them with a nice calm quiet uterus before you put the semen in, then it's an awful lot easier to deal with.
And how about then, Andrea, mares that that reabsorb early, mares that there's also a question here in relation to mares that abort. There's a particular question here in relation to a mare that would have aborted in the previous year. Should she be cycling again by mid-March? But also, just maybe a little bit of information around the mares that, those early embryonic losses, that can pose such an issue for people as well.
Yeah, early embryonic loss is a really difficult one for people because there's nothing to look at, So if you have a mare that aborts at this time of year, unless the foxes have gone away with it in the middle of the night, you'll normally have a fetus, and ideally you'll have a placenta, and that can go up to the equine centre, and they'll be able to give quite a lot of information as to why that's happened. I mean, in my experience, I know we don't thankfully see too many herpes abortions, but the most common cause of abortion, certainly in our practice, would be placentitis, ascending placentitis, or cord problems, twisted cords and that kind of thing. So, but when you get early embryonic loss, it's very difficult to know, why that's happened, and whether there's a problem with the embryo, or whether there's a problem with the uterus where the embryo is living. You can get a few clues. I think if you scan a mare at 15 days and she's in foal and everything looks good, and you come back at 19 or 20 days and everything looks good, and then you come back at 30 days and it's just gone, and there's no sign of any inflammation. The mare hasn't come back into season. She doesn't look anyway irritated. My feeling is in those situations, that's probably more likely that it just wasn't a good embryo. Either genetically, you know, the mare and the stallion just weren't very compatible in that instance, and it just wasn't a viable embryo. Or you can have it a little bit sometimes if you cover too late post-ovulation, that can cause these weak embryos. You know, and in that situation, it's more likely that just the embryo failed rather than that the environment was hostile. But if you scan a mare at 15 days and everything looks okay, and then you come back at 20 days and you can see maybe a little bit of edema, things aren't looking so good, and then you come back at 30 days and the pregnancy's gone and she seems to be in season or a bit inflamed, then in that situation you can feel like it's more likely that the environment was a bit hostile, that the mare wasn't really properly clean, and that when her cervix closed and she came out of season, there was just a bit of irritation and inflammation, and the embryo just wouldn't do in there, and the cervix opened and out it came. So that can help a little bit. Unfortunately, it's very rare we actually get these early embryos to try and do any sort of testing on. So we try and really look at the mares for clues in that situation. So if everything looks okay, I would forgive a mare one embryo loss in any situation, because I think it's quite common to lose them, particularly if you're using frozen semen. In that situation, the embryo loss can be a little bit higher because some of the semen doesn't like the freeze-thaw process and it can damage the DNA. Or full heat covering, you get slightly higher rates of embryo loss with that. Post-ovulation covering, if the mare is too long ovulated, that can happen. Or as I say, it can be just one of those things that is just a poor quality embryo. But if it's happening repeatedly, then you have the option of always trying a different stallion to see if it's a genetic incompatibility, or doing some investigative work at that stage. And there's a couple of things that can be done, like your biopsy, cervical swabs. Cervical swabs tend to work quite well, but they rarely show up something really surprising. So normally, not always, but usually when you've a dirty swab, you're going to have had an idea by scanning her that the mare was dirty. And some infections in mares can be burrowed really deep into the uterine wall. So a negative cervical swab, and I think this is probably quite an important one for clients to realize, that just because a mare swabs clean doesn't mean she's actually clean. She could have a really burrowed, deep, dormant strep type infection that only aggravates her when you put semen in there. So, a negative swab doesn't mean there's absolutely no problems in your uterus. It is useful, particularly when you get a positive, because you can see what's growing, but just because it's negative, it doesn't necessarily mean there isn't a problem. So you can do a biopsy, or the other thing you can do is a low volume lavage, where you put in a small amount of saline in, flush it in around the uterus, bring it back and spin that down, and that can be quite useful. So yeah, I would say if mare is losing pregnancy repeatedly early on, she would be worth investigating to see is PMIE the problem rather than some embryological issue.
There's another question here, a submission. I have a mare in foal, 8.5 months, lost the fetus last year to placentitis. Should I have her scanned now, or other possible intervention?
I definitely would. Sometimes placentitis can be a one-off. We tend to see it in our practice. We tend to see it reasonably commonly in young mares, actually, sort of maiden mares in their first pregnancy, particularly if you have 3-year-olds being covered, or even 2-year-olds in non-thoroughbreds. And I think with them, it's because the uterus isn't really fully developed and fully mature, and so the placentation is this situation where it's a kind of thin placenta poorly attached to the uterus, and they sometimes just don't go the distance and they get placentitis. But more commonly it tends to be in older mares, where you have issues with the cervix, maybe issues with a pneumovagina, maybe the mare wasn't fully clean when she was covered. Maybe she's bad conformation and you have a little bit of contamination, and that infection works its way from the cervix up. It causes placental separation, and then the mare aborts. So those mares, you can do something about those in a number of cases if you catch them early enough before they start to show signs. So I would say if you've had a mare who's aborted with placentitis before, personally, I would always preventatively treat those from when they're about 6 months pregnant, and we use antibiotics for 5 days a month. We use TMPS because that crosses the placental barrier, and we tend to use that possibly in conjunction with either aspirin or Trental, which is pentoxifylline. Aspirin will thin the blood slightly, so will help deliver the antibiotics better and will also help the blood flow between the placenta and the uterus. Pentoxifylline is a vasodilator, so that will do the same thing. And sometimes if they're showing signs of irritation by maybe bagging up or any sort of vaginal discharge, we put them on Regulate also to try and quieten down the uterus and keep the cervix closed. But if the mare is otherwise well and there's no sign of bagging and there's no sign of discharge, usually just the antibiotics for 1 week a month is useful to keep everything kind of quiet. And I probably would scan her placenta. And you can do that rectally, you can do it transabdominally, or you can do it rectally, and you get a fairly good idea if the placental thickness is normal and if it's not separated and if everything looks well. Even if it looks okay, I would consider, if she's lost her pregnancy before, maybe treating them. I mean, it's obviously not ideal to be using antibiotics unless you need to. But in this situation, these are probably mares that it's worth consider treating preventatively for those last few months of the pregnancy, just for 5 days a month.
And just maybe, that you're mentioning antibiotics and that, and, obviously, I mean, discretionary use of antibiotics is coming more and more to the forefront of conversation in all matters, whether it's equine or whether it's dairy or whether it's whatever enterprise it is. And, obviously in terms of the management of mares, in the sense of when you do your pre-breeding check and, those difficult mares when you do your post-breeding check, and, there has been the tendency over the years to use antibiotics with the lavages and so forth. What's your take, in the sense of where you see things going for the future with all of this as well?
Well, I think, every time we get an opportunity to not use an antibiotic, we should try and take it. I mean, there's no doubt about it, there's overuse of antibiotics in all aspects of veterinary and human medicine. Certainly, we in our practice, and I think most vets, are trying to really preserve the big gun antibiotics, the fluoroquinolones and the cephalosporins, for animals that are really sick. And those antibiotics, I don't think we're going to have them very much longer, to be honest. But really, so I'm very against using, these very strong, very important antibiotics for reproductive use, unless it's absolutely necessary. We try not to use antibiotics routinely, so we don't use them in newborn foals. So this kind of notion of giving a newborn foal 3 days antibiotics just routinely, we don't do that. We only give foals antibiotics if we think they're at risk of sepsis. In terms of mares, certainly with thoroughbreds, we do a lot of swabbing. So we don't tend to use antibiotics in those, again, unless it's necessary. I probably still do use them from time to time. I use just quite a small dose intrauterine, and what I use in our practice is penicillin and gentamicin. And what I tend to do with those sometimes is those mares that are, the mares that would be susceptible to PMIE, I tend to use sometimes antibiotics in the flush with DMSO. That would be one of the treatments I use quite a bit, because the DMSO is a carrier, and that tends to be quite good to carry the antibiotics across the uterine wall and deliver it there. And then you're using quite a small dose of antibiotics, and you're getting it in, where you want it to be, rather than necessarily putting the mare on antibiotics or using them for several days in a row. So I do use them. I don't try and use them nilly-willy. So I think if mares are, look clean on their foal heat, I'll just take a swab. I won't use any antibiotics. If they look dirty on the foal heat, the day I take the swab, I'll usually give 1 dose of pen and gent then. And if they swab positive, then I will go back and treat those for another 2 days. So, you need to find the balance between, not using antibiotics unnecessarily and recognizing that bacterial infections in the uterus of mares will render them infertile if you don't treat it. So there are situations in which you need to, but I think we do need to sort of get out of this notion that every mare needs a shot of antibiotics after she's covered, because if they're healthy and they're resistant, they don't. But the ones that do need it, they do need it, and they will have trouble without it, you know. So that's where I would be.
Talk is chasing us, Andrea. I'm just thinking we might just, you know, just from the perspective that we did say that we would talk about them, maybe a little bit of a mention in terms of some key things to bear in mind going into foaling, and we'll give an extra little couple of minutes just to kind of address a couple of little things.
So what I'll do is I'll leave that slide, because that's kind of more or less similar to the other one, and just go on to this slide.
Yes, absolutely, yeah.
Is that okay? I can't.
That's fine, yeah. Even not to go through the slides in detail, but just to kind of give a couple of pointers in terms of going into foaling now, that your key tips for people.
Okay, so my key tip, if I had only one key tip, and if time is tight, my key tip is to foal a mare in a clean stable, a clean place. So there's a lot of work being done in the last few years about sepsis in foals, and why foals get it, and you know what we can do about it. And the most important thing you can consider with mare foaling is where is the mare going to foal, because the most common infection you get in newborn foals is E. coli, which usually comes from the environment, so it's from fecal contamination. So if a mare falls down in a dirty stable, the mare's lying down, she's getting up, she's getting down, she's rolling around as she needs to do, and the foal comes out, and the first thing it does when it gets up is it starts nuzzling around her hind legs. So it's got its nose in under her stifle and in her bag and everywhere. And if that skin has been contaminated with fecal material, then the foal is going to ingest E. coli before it ingests colostrum. So foals are born similar to calves and lambs and everything with no antibodies and no immunity. So they're naive, and their immunity comes from the colostrum, which crosses the gut wall. But the gut wall is completely non-specific, so anything can cross it. And once things start to cross it, it starts to close. So what you want is you want the first thing to cross the gut wall to be colostrum, not E. coli. So the environment, you could have the best colostrum in the world. The mare could have the most wonderful colostrum, and the foal could drink it in a nice time frame. But if it's already after licking her bag or her hind legs and they're covered with fecal material, then those antibodies are going to have a really busy job to do before they get to do anything, and the foal is at risk of sepsis. So the clean stable is really, really important. Straw, not shavings or sawdust, because the shavings and sawdust get everywhere. I think when you're getting ready for foaling, it's important to remember that foals do need colostrum, and that if the mare doesn't have her own colostrum, that you think ahead of what you're going to do. So if you have a lot of mares, you probably organise your own colostrum supply. If you don't, you need to have a friendly neighbour or a friendly stud or some friend who has a lot of mares, or someone that you can get colostrum from. I think we would see failure of passive transfer much more commonly in non-thoroughbred mares than in thoroughbred mares, because I guess, with stud fees, and I suppose a lot of thoroughbred mares tend to be foaled in foaling units. People tend to be very switched on to that, and we'll usually test the kilometre with a refractometer, and we'll know how much colostrum the foal has had and what the level of the colostrum has had. But sometimes with the non-thoroughbred,
it's an inexpensive piece of equipment. Really,
it's really inexpensive. They cost about €70, and they last forever. And it's really simple to do. All you need to do is take a tiny bit of colostrum from the mare before the foal drinks it, put it on the instrument and have a little look, and it's actually a sugar. It actually measures the level of sugar in colostrum, which is in line with the level of antibodies, and you can tell. So without spending too long on this, the level is quite important in the amount of colostrum. So my sort of advice would be, if the level of colostrum is 22 or higher and the mare has a reasonably big bag, then that's fine. Some mares will have colostrum of 30, brilliant colostrum, and it's like honey, it's really thick. And if you have a mare like that, she's not a maiden and she's got a reasonably big bag, then one side of the bag is going to be enough for a foal. You could actually take the other side and keep it and store it in case you have another foal, and it will freeze well and it will last fine till the following season. If you have a mare and she's been running a bit of milk and her colostrum measures 20 or 21, but she's not a maiden mare and she's got an enormous bag and she's loads of it, that will still probably be enough. Whereas if you have a maiden mare and she's a colostrum of 20 or 21 and she's a small bag, that won't be enough. So you look at the colostrum level and you look at the amount of it, and then you decide, do you need to supplement or not? Ideally, the best time to supplement colostrum, if you don't want to have to pay a vet to come out and stomach tube it, is before the foal drinks from the mare itself. Because once they drink from the mare, they tend not to accept a bottle. But if you check the colostrum and it's very poor, and you go and defrost it, and it's important to defrost it slowly, not to damage the antibodies, then you often can give it with the bottle as long as you do it before the foal drinks. If that doesn't work, your vet can come out and stomach tube it. And the other thing I think that has come into my consciousness recently about foaling is that, if possible, and if it's convenient to do it, and if you have the right environment and you have warm water and everything, if you can at all wash down the mare's hindquarters and in between her bag with warm water and with some soap. So either washing up liquid or just plain soap, hand soap, anything like that. Because if you have ever stuck your hand up in around a mare's bag, there tends to be quite a bit of waxy sort of smegma material in between the two sides of the bag. And actually, when that's been sampled in mares, that can be quite a common source of Clostridia. So if you do get an opportunity to wash down and clean that bag and dry it so it's nice and clean, and also maybe wash down and clean off her legs if she has been getting up and down and there's any dung, fecal contamination, tie up the placenta so that it's not flapping around her hind legs and then the foal is licking against that. So I think if you remember that the first thing the foal drinks should be the colostrum, and the first thing into the foal's mouth should be the colostrum. And the other thing is, I suppose it's really important for handlers, if you want to check and see if a foal has a suck reflex, that if you're sticking your own fingers into a foal's mouth to check it sucks, that they're clean, because anything that goes into their mouth will go into their gut and will cross their gut wall in the first 12 hours or so. So you need to be really religious about hygiene if you want to try and prevent infections in foals. And, prevention is definitely way less expensive than treatment.
Absolutely. There's actually a question, and we'll just take it here maybe as the last question. When do you advise this washing of the mare's hindquarters? Is this something that you do once you see her bagging up, or when it's closer to foaling time?
Yeah, much closer to foaling. Yeah. So if you are watching mares and you're fairly familiar with mares and when they're likely to foal, you'd really be doing that just on the evening that you think she might be likely to foal. So if you know your mare well and she's normally eats up, and then she's due and she's given all the signs and she has wax and everything, and then she's not eating and she's a bit uncomfortable and a bit agitating herself, that can be a good opportunity to wash her at that point. But don't worry, if she foals and you haven't washed her, you can do it before the foal drinks. So once she gets up after foaling, before the foal drinks, that's still a good time to wash her and tie up the placenta and get it out of the way. If you don't get an opportunity to wash them, it's not a problem if they're in a clean stable. So the most important thing you can do is have them in a clean environment in the first place, because if they're in a really clean environment, you don't need to do a lot of washing. But,
actually, just for people who may not have heard our December webinar, Alan Creighton from the Irish Equine Centre gave lots and lots and lots of practical tips for people for their stable yards. But one element of that was around disinfection of stables, with the references to the different disinfectants for different purposes and that as well, so people could listen back to that as well. And I suppose like you do have, as a breeder, you have control over certain things, and you have got control over identifying whether the quality of the colostrum is okay. You have control over the environment in which your mare is foaling and in which that foal is entered into. And you have control over things like the care of the navel, and you have control over the hygiene that you bring to the table with your own hands and things like that as well too. So you have, in certain elements, there's no control, but there are certain elements where one has the capacity to input that control, and one should do so if they can at all.
Absolutely. I mean, a mare is better foaling in a field than a dirty stable. by 100 miles. I mean, a dirty stable is actually, you know, probably the worst possible place for a mare to foal. It's bad for her. She's more likely to take in, you know, particularly when her vulva is open and swollen, she's more likely to take in contaminants into her uterus. The navel is more likely to get infected. And most infections in the foal, even if they end up with joint ill, and people worry about them coming through the navel, and they can, and it's important to clean the navel and close that up. But most infections tend to come through the gut route. The oral route is by far and away the most common route for infection in foals.
The clock has beaten us, Andrea.
Okay, no worries.
The clock has beaten us. I actually, you know, we could easily sit here for another hour and easily have much more questions to come. There are a couple of questions there we didn't actually get to, because they were kind of going back over areas that we had already mentioned, and we might look at those by return of email, maybe tomorrow.
Sure.
But, I'm extremely grateful to everybody who joined us here this evening. I'm extremely grateful to you for your time, for your massive expertise in the area. And you know, that comes across loud and clear. You know, certainly over the years, veterinary science continues to see progression. You know, there continues also to be new challenges that come with that. For certain, the technologies that are there with scanning machines and all the rest, I mean, there's so much more, I suppose, sophisticated now than they were 10, 20 years ago. There's a lot more that you can see and do with all that. But at the end of the day, you know, it's the practical experience that individuals such as yourselves bring to the table that, you know, that get to the bottom of the difficult questions that are there as well. And I know you're doing that, and you're doing that day in and day out. And a sensible approach, you know, is part of that as well. With the welfare of the horse always to the fore. So, like I say, my thanks to you. If there's any parting comment that you would like to make as a parting advice or comment, or something that you feel that, you know, you wanted to mention or maybe didn't mention before we tidy up.
I could literally prattle on all day about stud work, but I suppose the most important thing, I think, for people to remember is that, you know, mares, they're not machines, and we do ask a lot of them, and that the more preparation you put into kind of having things right, and the more you know, realistic you are, and the more people understand the process that they're engaging with, the better the results they get. So I mean, I think most vets who are doing stud work do have a big interest in it and do have a lot of information and are very willing to share it. So I would suggest to people, you know, to engage with their vets and discuss things with them. And, you know, maybe, I suppose sometimes people think that we just do all these things with mares and that maybe they're not necessary, but maybe to engage and know, you know, why certain things are being done and how they'll help. Because you know, I think mares, they are very fertile animals. They do, in fairness, most mares reward their owners with a large number of foals, and the more you can do to help them with that, then the more the better their welfare is, and the more profitable the whole business is for people.
Absolutely. So look, I am going to have to say thank you and good night to everybody. Just with the parting comment that our next webinar is on February the 2nd, the first Tuesday of the month. So until then, might I say, stay safe, everybody. Good night, and thank you very much to you all.
Super. Okay. Thank you.
Thank you, Andrea. Thank you.